Okay, let's dive in. Here's a number that really stops you in your tracks. Every 36 seconds, someone in America dies from cardiovascular disease.
It's staggering. And a huge part of that, often flying under the radar, are these high blood pressure emergencies.
Exactly. They're called the silent killer, right? But maybe that's not always accurate when things get critical.
That's the key point. It is silent until it isn't. When a crisis hits, the body often sends out pretty loud signals, really dramatic ones sometimes.
Like a crushing headache or suddenly finding it hard to breathe.
Precisely. And the big danger is people chalking it up to, oh, I'm just stressed, or it's just anxiety.
When it's actually your organs basically screaming for help because the pressure is dangerously high.
Exactly, your organs are under attack.
So our mission today is to cut through all that confusion. We want to give you clear, actionable knowledge, turn that silence into something you can recognize immediately.
Yeah, making a shout you can't ignore.
We're focusing on, let's say, the 3 core things. The critical number, those 5 big red flags, the symptoms, and then what do you actually do?
Because the timeline is incredibly tight. When those symptoms show up alongside the high numbers, we're talking minutes, not hours.
Right. Okay, let's start with the numbers then. That seems to be where a lot of the initial panic comes from.
It is. The numbers give us that first crucial snapshot of what's happening inside your cardiovascular system.
People see a high reading on their home cuff and, they freak out. But they don't always know how high is truly dangerous. What separates worry from a 911 call?
Okay, so the absolute danger zone threshold, the number that should immediately set off alarm bells, is a blood pressure reading of 180 over 120. So 180, 120 millimillimeters G or higher.
180 over 120.
Yes. Once you cross that line, you're in what doctors call a hypertensive crisis.
A crisis, okay. So let's say I'm at home, I see that number, 180, 120, maybe higher. What's the one thing that tells me if this is a call the doctor soon situation versus a call 911 right this second emergency?
It comes down to one critical factor. Are there symptoms of active organ damage happening right now?
Active organ damage, okay.
Right. So we actually divide this crisis state, even with the same high number, into 2 distinct categories based purely on whether those symptoms are present.
Okay, let's break down those 2 categories. What's the first one?
The first is called hypertensive urgency. This means your blood pressure is way up there, 180, 120 or more, but crucially, your vital organs like your brain, heart, kidneys, they seem stable for the moment.
So no obvious signs of immediate damage.
Exactly. No acute signs. Now, this still needs medical attention pretty quickly, within a few hours usually. You'd typically call your regular doctor to figure out how to bring that pressure down safely.
Okay, that's urgency. So what's the other one? The really scary one.
That's the hypertensive emergency. Same dangerously high number, 180, no 120 or above. But it comes with those severe symptoms we mentioned.
The ones indicating organs are actually being harmed right now.
Precisely. The symptoms are the signal that, metaphorically speaking, the fire has spread and is actively causing damage. This needs immediate emergency help. 911, no delay.
Got it. Symptoms are the absolute key differentiator.
Absolutely.
Now, I saw a statistic that really jumped out. Over 80% of adults over 75 have hypertension. It's huge.
Yeah.
Is there something about getting older, beyond just blood vessels getting stiffer, that makes this kind of sudden crisis more likely?
Well, the vascular stiffness is definitely the main player, yes. As we age, our blood vessels just lose that flexibility. They can't handle sudden surges in pressure nearly as well.
Makes sense.
So yeah, being over 65 is probably the single biggest risk factor for these hypertensive crises.
And what else kind of loads the dice? What other factors increase the risk?
Well, having chronic conditions like diabetes or kidney disease puts a lot of ongoing strain on the whole vascular system. That makes you more vulnerable.
Right.
But often for the crisis itself, there's an acute trigger. Something specific happens, like someone suddenly stopping their prescribed blood pressure medication.
Oh, wow. So medication compliance is huge. Absolutely critical. Or sometimes it's an interaction with another drug, maybe even an over-the-counter one that people don't realize can spike their pressure.
Like certain decongestants.
Exactly, things like that. These actions can unfortunately turn hypertension that was under control into an immediate life-threatening emergency.
Okay, so 180 to 120 is that floor, that danger threshold.
Uh-huh.
But like you said, the real decider between urgency and emergency is recognizing those symptoms.
Yes, that's the crucial skill.
So we need to move beyond just the numbers and really decode what the body is telling us. What are these big 5 alarm signals, the signs that say organs are in trouble now?
Knowing these is what triggers the right response, the potentially life-saving one.
Okay, let's take the first one. Chest pain or pressure. We all know chest pain is bad. But what specifically is happening to the heart in that moment?
Yeah, this isn't just like a pulled muscle feeling. People often describe it as crushing, real tightness,
Yeah.
or that classic feeling like an elephant is sitting on your chest. What that signals is the heart is really struggling against that extreme pressure. It can't pump blood effectively. It could even mean a heart attack is starting or imminent.
Okay, crushing chest pain. Got it. Number 2 is a severe headache. Now, headaches are common. How do we know this isn't just a bad migraine? What's the emergency signal here?
That's a great question. The key difference is often the suddenness and intensity. People describe it as the worst headache of their life, sometimes call a thunderclap headache because it comes on so fast and is so explosive.
Thunderclap headache, okay.
That suggests the pressure inside the skull is dangerously high, affecting the brain's blood vessels. And often it might come with really severe nausea, maybe even vomiting.
Right. Okay, third sign. Shortness of breath or difficulty breathing.
What happens here is when that pressure is sky high, the left side of the heart, the main pumping chamber, just can't push the blood forward effectively.
So the blood backs up.
Exactly. It backs up into the lungs. This causes fluid buildup, what we call pulmonary edema. And the feeling is like you're drowning from the inside. You can't catch your breath, even if you're sitting completely still.
That sounds terrifying.
Mhm.
And it signals the heart is really struggling, possibly failing acutely.
Yes, acute heart failure is a major concern there.
Okay, fourth sign involves the eyes. Vision changes or loss.
Right. The eyes are like a window into our vascular health. Sudden blurred vision, maybe losing part of your vision, seeing spots or flashing lights.
What's causing that?
It can mean that the intense pressure is actually damaging the tiny, delicate blood vessels in the retina at the back of the eye. Or, even more concerning, it could mean blood flow to the vision centers in the brain is being affected.
Yikes. Okay. And the fifth sign sounds like it points towards stroke risk.
Mm.
Sudden neurological symptoms,
Absolutely. This is a big category. It includes things like sudden confusion, disorientation.
like not knowing where they are.
Yes, or difficulty speaking, maybe slurring their words. It could also be sudden weakness or numbness, typically on one side of the body, face, arm, or leg, or even just losing coordination, suddenly becoming clumsy or unable to balance.
So any of those sudden brain-related changes.
Any of those. They all indicate that brain function is being compromised by that dangerously high pressure, raising major red flags for stroke.
Okay, let's pause here for a second because this is important. The books focus on that 180, 120 number, but what about situations that aren't so clear-cut? Like, say, an older person, maybe someone whose blood pressure is usually pretty low, and they suddenly just seem confused or dizzy, or maybe they fall. Could that milder symptom, even if their pressure isn't quite 180 or 120, still be an emergency call?
Yes, absolutely. This is where knowing someone's normal or baseline is so critical.
Right.
While 180, 120 is the official crisis number, the symptoms are telling you that organ damage might be happening relative to that person's usual state. For older adults, the signs can be much subtler.
Like confusion or fatigue being the main thing.
Exactly. Confusion, dizziness, sudden unexplained fatigue, or a fall might be the only outward sign that something catastrophic is happening with their blood flow because of a relative pressure spike.
And you mentioned gender differences too.
Yes, women sometimes present differently. They might experience more nausea or severe back pain, or maybe subtler chest discomfort instead of that classic crushing pain. So we need to be aware of these less typical presentations too.
Great, that's really crucial context. Symptoms matter and context matters.
Yeah.
So we know the signs now. Let's pivot to the critical response. What's the immediate first aid when someone has that high BP and one of those big 5 symptoms hits?
The golden rule here is simple and non-negotiable. If the blood pressure is 180, 120 or higher, and they have any of those big 5 symptoms we just discussed,
Yes.
the immediate first step is call 911, period. Don't hesitate. Don't try to drive them yourself. Don't wait to see if it gets better. Call 911.
Okay, call 911. That gets professional help on the way. What can we do in those vital minutes while waiting for the ambulance?
Good question. There are a few key things. First, try to create a calm environment.
Reduce stress.
Exactly. Get the person away from noise or commotion if possible. Speak to them in calm, slow, reassuring tones. Remember, stress and panic actually constrict blood vessels, which can push the pressure even higher.
Okay, calm environment. What about how they're positioned?
Right. Position them for safety. Help the person sit up straight or maybe slightly reclined. A comfortable chair or propped up in bed is good.
But not lying flat.
Definitely not lying flat if they're conscious and having trouble breathing. Sitting up helps ease the strain on the heart and makes breathing easier. Also, loosen any tight clothing, collar, belt, waistband.
And if they start vomiting or lose consciousness.
Then you need to place them in the recovery position on their side to keep their airway clear and prevent choking.
Got it. Recovery position if needed. You also mentioned a breathing technique.
Yes, there's a simple technique called 4-7-8 breathing that can sometimes help engage the body's relaxation response.
How does that work?
You guide them to breathe in slowly and deeply through their nose for a count of 4. Then hold that breath gently for a count of 7. And then exhale slowly and completely through pursed lips for a count of 8.
In for 4, hold for 7, out for 8.
That's it. Repeating that cycle a few times can help calm the nervous system and, maybe provide a small bit of relief while you wait. It focuses the mind, too.
Good tool to have. And while we're doing this, we also need to be gathering info for the paramedics, right?
Absolutely crucial. Information gathering. Get their current medications together, ideally the actual bottles. Note down any recent blood pressure readings if you have them. Try to remember exactly when the symptoms started.
And allergies.
Yes, and definitely any known allergies. Having all this ready for the emergency responder saves precious time and helps them treat the person safely and effectively.
Okay, now, just as important as what to do is what not to do. What are the critical mistakes people make that could actually make things much worse?
This is so vital. Probably the biggest and most dangerous mistake is trying to rapidly lower the blood pressure yourself using home remedies or, critically, medication that isn't prescribed for that person for this specific situation.
You mean like giving them someone else's blood pressure pill?
Yes, or even their own medication if it's not meant for an emergency like this. And specifically, never give someone sublingual nitroglycerin, the little pill under the tongue,
Right.
unless it has been explicitly prescribed for them by their doctor to use in exactly this type of hypertensive emergency scenario.
Why is lowering the pressure too fast so dangerous? It sounds counterintuitive.
It does, but the danger isn't just lowering the pressure, it's the speed of the drop. If blood pressure plummets too quickly, especially in someone whose brain has kind of adapted to running at a higher pressure,
Okay.
it can suddenly starve the brain of blood flow. That's called ischemia. And it can actually cause a stroke that might not have happened otherwise. Managing the rate of reduction is a very delicate balancing act that only medical professionals should handle in an emergency setting.
Wow. Okay, so no unauthorized meds. What about something common like aspirin? People think, heart attack, give aspirin.
That's another critical base. Do not give aspirin unless you are absolutely 100% certain there's no bleeding happening in the brain.
And you usually wouldn't know that at home.
Exactly. In a hypertensive crisis, there's a risk the high pressure might have caused a hemorrhagic stroke, which is bleeding in the brain. Aspirin thins the blood, so giving it in that situation could be catastrophic. Best to leave it to the pros.
Got it. No aspirin. Any other don'ts?
Yes. Never encourage rapid movement or sudden changes in position. Keep things calm and steady.
Okay, this is incredibly helpful. Let's try to pull this all together into that decision framework you mentioned. We essentially have two main paths based on everything we've learned.
That's right. Path number 1 is the immediate 911 criteria.
When do you absolutely call 911?
You call 911 immediately if the blood pressure reading is 180, 120 or higher A&D, the person has any of those severe Big 5 symptoms we went through. The crushing chest pain, the sudden shortness of breath, the confusion or neurological signs, the vision changes, or that awful thunderclap headache.
Any one of those symptoms with a high number means 911.
Yes, and I'd add severe tearing back pain to that list too, as it could signal something extremely serious like an aortic dissection, which is also linked to high pressure.
Okay, so that's the emergency path. What's path 2, the call your doctor first criteria?
That's for the situation where the blood pressure is 180, 120 or higher, but importantly, there are no acute symptoms of organ damage. Or perhaps if the readings are persistently high, say over 160, 100, but they only have mild, vague symptoms, like maybe a little dizziness or a dull headache.
So high number, but no big red flag symptoms.
Correct. In that case, you still need prompt medical attention, but it's usually safe to call your doctor or their office first to arrange an assessment within the next few hours rather than calling 911 immediately.
That clarification is huge. Urgency versus emergency. But, real life is often messy. Sometimes it might feel like a gray area, especially when deciding whether to call 911. People hesitate, right?
Right.
They don't want to overreact or be a bother.
That hesitation is completely understandable, but it can be dangerous. My advice is always, trust your gut. If something feels seriously wrong, it probably is wrong. I often tell people to use the what-if test. Ask yourself, if this was my spouse, my parent, my child having these symptoms, would I want them to wait it out? If the answer is no, then don't wait. Make the call.
That's a powerful way to frame it. The worst that happens if you call 911 unnecessarily is maybe some embarrassment.
Exactly.
But the worst that happens if you don't call when you should have is potentially tragedy.
Precisely. And that brings us back to preparation being the key to overcoming that hesitation.
Right. If you're worried about making the wrong call in the heat of the moment, the solution is to plan before the moment happens.
Yes. Have a written emergency action plan somewhere visible and easily accessible in the home.
What should be on that?
A clear list of all current medications, dosages too if possible, emergency contact numbers, maybe a log of recent blood pressure readings, and definitely write down those big 5 emergency symptoms as a clear reminder.
So when panic might set in, the plan is right there.
Exactly. It takes the guesswork and the emotional hesitation out of the equation when every single minute counts. Especially important for older adults who might live alone or have multiple health issues.
This has been incredibly insightful. We've covered the crucial difference between hypertensive urgency and emergency, pinpointed those 5 critical warning signs, and laid out the immediate action plan. Call 911 first if symptoms are present, then focus on calm, positioning, breathing, and information gathering.
That's the core of it. And the final piece really is overcoming that psychological barrier to seeking help.
That fear of bothering emergency services.
Yeah. So many people, especially older folks, worry about that, or about the cost, or just making a fuss. But trust me, emergency responders would vastly prefer to check out 10 false alarms than to miss the one genuine life-threatening emergency.
So the final thought for everyone listening is,
It's that your preparation makes all the difference. Having that action plan, knowing those symptoms, having your info ready, it transforms potential panic into organized action. You're not bothering 911. You're activating a necessary system based on clear signs. Your health, your life, or the life of someone you care about. It is absolutely worth the call. Don't let hesitation be the reason help arrives too late.